age, address, and if available, telephone number. And you give your telephone number to him. Be kind enough to give, because there may be many urgent situations when he wants your advice. So, as much detail as possible about this. I have added one more thing. If you also believe in it, you can also add date of birth, time of birth, place of birth. This is only to take the help of another equivalent and beautiful science called astrology for healing purposes. If you do not believe in astrology, you need not take the other thing. But if you do believe, you can take this. Because in certain so-called incurable diseases, we will erect the positions of the planets in his birth chart, and also the chart of the present age of him. We place before us the two charts, and we will be able to understand not only the medical causes, but also the causes of the cause and effect of what he has done previously, how his habits will be, how his environment will be, and other things. And then you will have a better understanding about this. A useful information I will give you, that in the year 1930, a very holy, pious, saintly man and his wife, a Rosicrucian Christian from France, named Max Hindale, and his wife Augusta Foss Hindale. Both of them MDs in medicine and DD, that is Doctor of Divinity in the law of theology of God. In Bible, not in the religious sense, but in its true sense. They know all the ancient science of the Old Testament. They, both of them, established an ashram called the Light of Christ in California, in a place called Mount Ecclesia in a province called Oceanside in California. And the ashram even today renders free advice of the cure of incurable diseases. If you just send the date of birth, time of birth and the place of birth of the patient to them, they will give you non-medicinal advice to have a sure cure of the many so-called incurable diseases. In 3 cases, I have consulted the gentleman, and the advice is given by him in 3 cases proved wonderfully effective. In an epileptic case, where a cure was not possible in any system of medicine, including homeopathy, because the case was almost congenital, so-called malformation of the brain, then taken the angiogram. And I sent his birth data to him, and he has prepared the chart, and he has also prepared the chart of his previous birth and the time of the death in the previous birth of the fellow. And then he has given a simple advice. Daily in the morning, ask the fellow before sunrise to take 2 cucumbers, 1 lemon and 1 tablespoon of honey, and within 6 months his epileptic fits will be cured and that will continue this lifelong instead of using all damn medicines. That is what he has written. And within 4 weeks, the fits were cured permanently, changing the diet advised by him. Now he is in a very high position in Delhi. And 2 more people I know. Another interesting thing for you to know about this gentleman is, of course, he is no more. He passed away 6 years ago. He has with him many doctors trained under him in homeopathy, allopathy, and magnetic healing. That is yoga type of healing through meditation. By meditating in the heart of the patient, a rose and a cross, and around the patient the light of the Lord Christ. Not in the rustic, rough, religious way, but in a spiritual way, he does all these things. Now, his hospital includes 12 different buildings. Each building is of a different color, and each includes the arrangement of the furniture in the room in a different way, and the doctors and the nurses that are sent to each hospital, they are decided according to the date of birth of the doctors and nurses in tune with the planets of the persons in the hospital. And people born during 12 different months are placed in the 12 different buildings separately. For example, those who are born between March 21st and April 21st, called the month of the Ram, Aries, they have the building and their room are decorated in orange, red color, and the lighting is also given according to the planet Mars. And the instrument given every day in the evening for half an hour for healing is drum music, because that is the music belonging to the planet Mars. In the second building, you will have the patients of the month of the bull or goddess, Vrishabha. And there, the color of the room is in marine blue, which is the color of the planet Venus. And there they have the stringed instruments like the veena, guitar, and other things in the evening given. Healing is wonderful. This is only the point of curiosity when some of you happen to visit there. Another most important thing is every year they produce a volume of their cures under the heading called medical astrology. How they diagnose the disease, how they approach to cure and all this. Of course, they treat medicine as unimportant as it should be generally. Their cure mainly consists of the diet, the altering of the timings of the diet, and the atmosphere they produce to the patient, the type of topics that are discussed as the hobbies, and the type of magazines given to the patient, and the way in which the doctor and the nurse keep company with the patient. They are very saintly. All the staff, including the servants, are strict and pure vegetarians in its true sense. And even the patients who go there, however rich he may be, however important he may be, has to observe a strict vegetarianism as long as he is in the institute. This is by way of interest. Of course, every year I get his annual volumes of the cures under the name medical astrology. We study them because it's a great research. Now there are doctors with him who can predict you the possible limits of your temperature tomorrow between 6:30 and 10. Now they erect a chart called daily chart of yours, and then tomorrow they will give you your temperature will be between these lines, and you are most probably having these troubles, sufferings, unless you control your diet the previous day. That is how they do. So, in the ancient Indian tradition, ancient Egyptian tradition and Chaldean tradition have, Babylonian tradition also, have great traditions, medicinal traditions of astrological use. And so, we use the study of the ancient Indian scientists and the modern scientists in astrology like Max Hindell, Alan Leo, Radolf Skinner, and others. There are about 56 of authors who know the advanced subject as a science beyond any doubt. They are, we can say, the foremost masters of the century who lead this science in the West. And if we go into the Sanskrit texts of the East, we find astounding things about medical study. So we can make use of these things. Another important point and interesting point is, you know, Hippocrates, you have heard the name of a great saint and a seer and a prodigy of medicine in the past centuries, whose first commercial allopath will have before him when he is doing his practice. He will have a picture or a photograph of this saintly man, Hippocrates. He is rightly known as the father of medicine, but now by the medical students and doctors, he is wrongly known as the father of medicine because no one of them reads his books, including the foremost professors of medical science today. They don't read his books. But he has written his treatise of 8 volumes of the Medica, that is the medicine. And he says in one of his definitions that a doctor who is not an astrologer and a palmist is a fool. That is one of his propositions. Of course, we may or may not accept his theories according to our limitations and ignorance. And he has devoted 3 chapters on medicinal astrology as to how to use it and other things. And one of those chapters is very, very interesting called Law of Correspondences. That is, which are in the belt of the zodiac above the equatorial belt of the earth corresponds to which part in your body and all these things. He has explained, just as the ancient Indians explained, that when you are in your mother's womb with your head like this, hands like this, and legs like this, you take this as the center and the 360 degrees divided in 30. Then beside the 12 divisions and the planets that are posted at the time of his fertilization at the place, and his head corresponding with the eastern horizon of his place where he is born. Then you erect a horoscope and you find out which place in his body is vulnerable to diseases and which place is not, and which diseases the fellow gets and which diseases the fellow does not get, all these things. Now we will go back to our case taking of hand. This is the first step. You take a big paper, you clear these things first.
Sir, you kindly give the name of that saintly person.
Yes, of course, it's no more, but his wife and his disciples are there. Max Hindell. His wife is Augusta Foss. And the address is like this: Rosicrucian Fellowship, Asia, Oceanside, California. The Rosicrucians are a sect of true Christians in its spiritual sense, not the religious sense, as they say, who meditate upon the rose and the cross, representing the rose representing the center of love in God, whose correspondence is in your heart. The cross representing the hardships of humanity on this earth. Of course, there are many false and fake organizations in the number of Rosicrucians, in the name of Rosicrucians, as you know. I think in Belgium itself I have found 2 or 3 false Rosicrucian organizations. But there is the true one. Always the existence of the counterfeit proves the existence of the original. దొంగ నోట్లు వచ్చేసాడంటే అసలు నోటు లాగా వాడు వచ్చేయాల్సిందే కానీ ఇంకోలా వేయడానికి వీలేదా కనుక ఎప్పుడు కూడా ఆల్వేస్ ది ఎగ్జిస్టెన్స్ ఆఫ్ ది counterfeit proves that there is an original to it. But in France and Belgium and Switzerland, I know many foolish false organizations in the name of Rosicrucians deceiving people grossly. Now, step one. First step. Please take down. The patient and his attendant narrates the history of sickness. Narrates the history of his sickness. He describes the sensations, the symptoms, and the behavior. Full stop. The doctor notes down what he says, observes how he narrates, finds out what type of language he uses, listens to the voice and its modulations. He also notices the diversions from the topic. What is reported by the patient is noted down directly. What is understood by the doctor is noted separately on a second sheet. So this is the first step you have to do. అంటే వాడు చెప్పడం మొదలెట్టాక వాడు చెప్తూ ఉన్నటువంటి పద్ధతి, వాడి కంఠధ్వని, వాడి మొహం పెట్టడం, వాడు నికేయించడం, సహించడం, ఇవన్నీ కూడా డాక్టర్కి కావాల్సిన లాంగ్వేజ్ కాదు. All the peculiar faces and mouths and appearances and modulations and the dirty jokes of the patient sometimes and digressions and the voice, all these things form part of the lesson of the doctor. So, first he takes down only what the patient says. 2. Write each sentence separately and leave off space before you begin a new item of complaint reported so that you may add when you understand the detail of each item. of each item. For example, no, don't take it from. Suppose he says, pain in the epigastrium daily, he says. Now, after half an hour discussion, he gives you, by the way, he was operated for gastric ulcer. So you have to insert this. Instead of writing it somewhere at Vijayawada or Kurnool, you have to write in the relevant place. So you leave the place before you start the next symptom. And suppose he says, it will be between 4 and 8 p.m. he gets. Like this, you will get a lot of information before you can wind up the case taking of a particular case. So first, jot down everything. 3 point. Take down almost in the same language used by the patient. This is very, very important. Don't boast yourself of your technical knowledge here. Because suppose if the patient says that he has pain in the left side of the chest, shooting into the left arm. Suppose you have left it off, you have written that it is a constriction of aorta. That is, you have interpreted, no doubt in the very correct way, but according to homeopathy, in a stupid way. Because what guides you to select a medicine is the sentence he has given, not the technical nonsense you have found out. This will never give you a clue to select a medicine. So, after 15 days or 20 days or 1 month before you review the whole case to change the course of action, if you refer to it, you will find what he has reported is gone into oblivion and your technical nonsense remains with you as the skeleton without the flesh and blood of the patient. So be very careful. First of all, note down the sentences and the words used by the patient as they are. That is what Hahnemann warns us. Next point. Do not interrupt the patient in the middle. Interrupt the patient in the middle by questioning, cross-examining or cornering the patient into a particular direction. This will stop the flow of narration and you may lose many important items. Please continue in the same item. Whenever there is a serious digression in the narration, mildly bring round the patient, round the patient to the required topic, by putting a small question. And then what happened? Suppose he says, you ask him, since how many years you are suffering? He says, first, when I had been to Tirupati on the occasion of my sister's marriage, he says, by the way, my sister was married late and we had a lot of agony about it for about 2 years. And Before we got our sister married, my father died. Therefore, I had to take a lot of trouble. I have seen many bridegrooms, but each of them was aristocratic in his own way. Now you ask him, and then you have to Tirupati, what happened? Then he will come to the point, like that. Then again he begins to narrate. We were there to perform the marriage. In those days, marriages were performed for 5 days. Then he digresses again. And then you will ask him, what happened to you at that occasion? Like that. You can just bring him mildly without giving him a jerk. Because the moment you make him sensitive and conscious of some tension, his flow stops and he forgets 6 among 10 and he narrates only 4. So the responsibility of allowing him to narrate the required information is yours without allowing him any time to digress. Experience useful. Please continue. Let him narrate the history of his sufferings until he himself stops and says, that is all. Next point. Read out each point to him. The next step. Read out each point to him slowly so that he may be tempted to add some more detail by recollection. At the end of each point, you can ask him as many questions as you like. See, look here. While he was first narrating, don't interrupt him at all, except bringing him to the topic when he digresses. A second time, when you are reading the points to him, with each point, you can put as many questions as you like, because now there is no danger of you are interrupting him. While questioning, you ask him to point out the exact location of the pain, the character of the pain, and the continuous occurrence or the recurrence at intervals. అప్పుడు నొప్పి వస్తుంది చాలా మంది, గుండెల్లో నొప్పి అండి, రాసుకో. ఎక్కడ గుండెల్లో నొప్పి అంటే ఇక్కడ చూపిస్తాడు, ఒకరు ఇక్కడ చూపిస్తాడు, తెలియదు ఇక్కడ చూపించేవాడు గుండెల్లో. విశాఖపట్నం జిల్లాలో మెండారం పట్టిందండి, ఎక్కడంటే ఇక్కడ చూపిస్తాడు. అదేమిటంటే నరం పట్టుతూ ఉండడానికి మెండారం పట్టుతూ ఉంటాడు. ఎట్లాగో వెళ్ళింది, మోకాట్లో మెండారం పట్టిందండి. If he says pain in the heart, you should ask where. Then the fellow may show here or here or here, or sometimes exactly here, when you have to suspect some complaint in the heart. So ask him to point out. Many cases narrating about gunde noppi, heart pain, they belong to the pain of the chest, or the bones of the chest, or the muscles of the chest, or the epigastrium and the gastrium itself sometimes. Like that. So ask him to point out, him or her to point out each pain and the character of the pain. That means you can describe them that sometimes pain will be like this, twisting, gudda pindutunnadu, or piercing, పొడుస్తున్నట్టు పోటు పొడుస్తున్నట్టుందా, ఏదైనా బరువు ఎత్తినట్లుందా, వాళ్ళు చూస్తారు, లేదా నొక్కినట్లుందా, ప్రెస్సింగ్. Then the patient will be able to understand by your sympathizing nature, and he will be able to express more. So you note down these points. They count much because if it is twisting pain like this, the patient most probably comes under the metallic drugs, cupramate, ferromate, aramate, zinc-amate. So metallic drugs. If he narrates a twisting pain, especially in very, very urgent cases like cholera, if the patient says that he has a twisting pain in the stomach or twisting pain in the calves and thighs and hands, like this, a single dose of cupramate will save the patient instantaneously within seconds, I take. Within seconds the patient will be relieved. And also there is what is called cramping pain. That is pain producing cramps in certain places. Sometimes when a person stretches in sleep, he finds his leg like this and he cries, balls are oh, he says. He cannot bear it. Somebody should come and make something with the leg. That is called the cramping pain. It makes the patient bawl out and cry out, even though he knows Shakespeare and Milton or Kalidasa. Even though he is a great scholar or a great VIP, he has to weep if there is a cramping pain. Timmirivel is conqueror, sir. ఇటా నరాలు తిప్పేస్తాయి అవి పట్టుకుని ఇలా తిప్పుకోవాలన్నమాట. ఓ నడుస్తాడు, ఇంకేం సస్సు లేదు. వాడు నోటికి కంఠస్థంగా భగవద్గీత అంతా వచ్చినవాడైనా సరే, బైబుల్ అంతా వచ్చినవాడైనా సరే, ఏమైనా సరే ఆ ముందు అరవాల్సిందే. తర్వాత cramping pain. Remember a set of drugs for cramping pain. Here also comes cupramate, rose starch for cramping pains, sulfur, hepatite, arsenicum, alcohol. First these drugs should come to your mind. If he says that he has a cramping pain, pressing pain, as if the part was pressed or compressed between two compress machines, like that. First comes plastic, then comes arnica, gasoline,